Welcome to my YouTube channel. Today we're going to talk about pupillary involving versus pupillary sparing cranial number 3, that is oculomotor palsy. So let's briefly look at the subdivision or the classification of cranial nerve palsy. We can divide it as pupillary involving or pupillary sparing. The oculomotor is kind of divided into two, where we have the motor being inner and the pupillary or the parasympathetic being outer. So any involvement or any lesion affecting the outer, such as compression by either an aneurysm, a tumor, or annihilation, will result to the with disruption of the parasympathetic fibers, therefore meaning we cannot constrict the pupil. If the pupil cannot constrict, what will the pupil do? The pupil will dilate. However, when it comes to causes such as ischemia, which majorly involve the inner part of the oculomotor, will majorly result to the palsy of the extraocular muscle, while sparing the outer part, that is the pupillary fibers. So in this, we'll have pupil sparing oculomotor nerve palsy. So we've mentioned that we have pupillary involving versus pupillary sparing oculomotor nerve palsy. So the features, the causes, just say the first one, the pupil involving is usually majorly compressive, such in case of an aneurysm, a tumor, and ankle herniation. Whereas in pupil sparing cranial nerve 3, we usually have ischemia, small vessel disease, for example, in diabetes. So in pupillary, we say that the outer part of the oculomotor usually the outer part of oculomotor is usually parasympathetic. So that if it is affected first, then you are going to have dilated pupil, that is a brown pupil. Whereas in pupillary sparing cranial number 3, you're going to have normal pupil because the parasympathetics are spared. The position of the eye, because in both the motor fibers are affected, you'll have your eye being down and out, and also in pupillary sparing having your eye being down and out. The most common cause of pupillary involving cranial number 3 palsy is usually posterior communicating artery aneurysm. This is a must know. So the posterior communicating artery aneurysm, when it compresses on the oculomotor, then you can develop pupillary involving cranial number 3 palsy. Whereas pupillary sparing cranial number 3, examples or causes is usually diabetes, hypertension, and vasculitis. The severity is usually for pupillary involving is usually urgent and may require a CT angiogram or MRI angiogram, and then because it is an aneurysm, while less pupillary sparing cranial number 3 is usually less urgent. The prognosis requires urgent intervention to prevent the rupture or herniation. Just look at the causes that we say. We said aneurysm, we said tumor or ankle herniation. Whereas the causes such as diabetes, vasculitis usually mostly self-limiting and usually recovers in weeks. The rule of thumb that a brown eye, that is caused maybe by aneurysm, as you have said, is usually urgent, and you need to get an urgent CT angiogram or MRI angiogram. Whereas the pupillary sparing usually have normal pupil is usually because of diabetic pupils. So the management of pupillary involving versus pupillary sparing cranial number 3 palsy. Pupil involvement, you see this one is compressive, and we said it's an emergency for you to rule out the posterior communicating aneurysm. So if it is an aneurysm, then you surgically repair the aneurysm either by clipping or coiling. If there's a tumor, you call the neuro team or you call the oncology team for referral. Pupillary sparing, that is mostly ischemic, and the cause usually diabetes and hypertension or vascularis. Of cranial number 3 palsy, you treat obviously the underlying cause, that is diabetes, hypertension, and vascularis. You can also do supportive care, that is patching one eye may help in diplopia, and this usually results in 6 to 8 weeks.